on environmental and social licensing and enforcement during the COVID-19 crisis. This one will focus on challenges for Indigenous peoples during the pandemic. Before I continue, I would like to note that simultaneous interpretation is available by clicking on the globe icon at the bottom of the screen and selecting English or Spanish. Antes que todo, les indico que tenemos interpretación.
This is a repeat of the existing of interpretation at the bottom of the screen. You just touch the world icon and choose your language of choice.
This is the final session of our 5-part series under the framework of the Regional Policy Dialogue on Environmental Licensing and Enforcement in Latin America and the Caribbean. My name is Davis Jones, and I work in the Environmental and Social Solutions Unit at the Inter-American Development Bank. I am the coordinator of the Regional Policy Dialogue. This topic on Indigenous people is new for our RPD, and I look forward to an enlightening discussion today. I also wish to thank our speakers and attendees for making room in your busy days to help share your experiences as we all work to improve our programs. Our 4 panelists and their institutions are very experienced in their field, so we should have an excellent discussion about the challenges and solutions being implemented. Each panelist will have no more than 15 minutes for your presentation. Please mind your time so we can address as many questions as possible at the end. I ask you all to use Zoom's chat feature, not the questions and answer feature, for submitting your questions. That way we can capture all of the questions and respond later to those that we can't address during the meeting. I also suggest that you add your email or WhatsApp number to your question so that we may follow up with you later if we run out of time. Now, please allow me to introduce Joseph Milewski, the Chief of the Environmental and Social Solutions Unit at the IADB, who will be introducing the rest of the session. Joseph?
Thank you, Davis. Buenos días a todos y con mis disculpas por el desorden detrás de mí, pero llegó mi mudanza ayer por la tarde viniendo de Argentina. Así que estamos todos con retos asociados con la pandemia, con retos asociados con nuestro trabajo, nuestra labor. Y justamente eso es una discusión muy apropiada en este momento por Zoom. Les agradezco a todos, a los panelistas, a los participantes y a los colegas por estar acá. Entonces, bienvenidos a la 5ª sesión de la serie de diálogos públicos regionales sobre políticas ambientales y sociales de la región latinoamericana. Estas están enfocadas en los retos sociales y ambientales que se enfrentan durante la pandemia generada por el COVID-19. En esta sesión abordaremos algunos de los retos específicos que enfrentan los pueblos indígenas, así como las entidades gubernamentales para involucrarlas en la toma de decisiones o intervenir de manera culturalmente adecuada a pesar de las restricciones actuales. Quisiera resaltar que los pueblos indígenas en la región latinoamericana representan más de 42 millones de personas y hablan aproximadamente 560 lenguas. La mayoría, 38 millones, viven en México, Guatemala, Perú y Bolivia, pero muchos países de la región tienen pueblos originarios en su seno y están en el corazón de la identidad de nuestros países. Son los primeros pobladores de estas tierras y tienen una gran diversidad sociocultural y lingüística, amplio conocimiento tradicional y múltiples formas de organización social para sus tomas de decisiones. Como muchos sabemos, la pandemia de coronavirus constituye una grave amenaza para la salud de los pueblos indígenas de todo el mundo, en particular para los pueblos de la región de Latinoamérica. Estos diálogos
These
buscan brindar
dialogues
la oportunidad a
seek
los
to
distintos
find an
actores, tanto
opportunity
del
for the
gobierno
different
como de la
actors in
sociedad
the
civil,
government as well as civil
especialmente
society,
de los pueblos
especially the
indígenas, de tal
indigenous
manera que
people,
puedan
that
compartir
they can
sus
share their
experiencias y
experiences
examinar las
and
medidas
examine
implementadas desde cada uno de sus
measures
lugares de trabajo.
implemented from each one of their job
De esta
sites.
manera, cada
In
uno
this
podrá
way, each
identificar
one
lo que
can
considere
identify
puede
what they
resultar
consider could
adecuado
be
en
adequate
su propio
within their
contexto
own
e
context
inspirarse para
and be
encontrar
inspired
soluciones
to find
innovadoras
innovative
tan requeridas
solutions
en esta
that are so
situación tan
necessary in this
grave y tan
particular and
particular
severe
a la cual nos
situation we're
enfrentamos.
dealing with.
Las sesiones anteriores
Past
de
sessions
esta serie
of this
especial
series
fueron sobre
were
consultas
on
virtuales con las
virtual
partes
consultation
interesadas,
with interested parties,
fiscalización
supervision
del
of
cumplimiento
the
socioambiental,
social and
implementando el
environmental compliance,
distanciamiento social,
implementing social distancing,
discrecionalidad en la fiscalización y
discretionality in supervision
licenciamiento
and
en los momentos
licensing
de
in times of
crisis
crisis,
y
and
institucionalizando las lecciones
institutionalization
aprendidas
of
de las
lessons learned
emergencias.
in emergencies.
Paso la palabra a mi colega
I'd
Juan
now give the floor to
Martínez,
my colleague
quien
Juan Martinez,
explicará
who's
los
going to
objetivos
explain the
y el
objectives
flujo de
and
la
the
reunión.
flow of the
Les
meeting.
agradezco muchísimo. Que
And I
tengan
thank
un
you
buen
very
día.
much and have a good day.
Gracias, Joseph.
Thank you, Joseph. And first of all, I'd like to
Un saludo fraternal a
send a special greeting to our Latin American region,
todas y todos
where
que estén conectados,
all
estén
who
gozando
are
de
connected,
buena
I
salud
hope, will be enjoying
y que
good
estén yendo
health
bien en
and
todas
that
sus
things
actividades.
are working
Segundo,
well despite
saludar
the situation. Secondly,
como parte de la
as
bienvenida que ya
part
hizo
of
el
the
secretario
welcoming
Joseph
of my
a las
colleague
personalidades
Joseph,
que
I'd
estuvieron
like
las
to
semanas
greet the personalities
anteriores
that we have as speakers this morning,
ya lo
which,
recalcó
as David said,
experiencia entre
have a
otros
great deal of
representantes del
experience. We have
Ministerio de
the
Asuntos
Vice Minister
Indígenas
of
de
Indigenous
Panamá y
Affairs from
también del
Panama
gobierno,
and
al señor Pop,
the Mr. Pop
representante del FILA,
representing
Fondo
FILAC,
Indígena de
which is
América
the
Latina y el
Indigenous
Caribe,
Fund for Latin America and the Caribbean,
colegas
as well as other
que también harán su
colleagues who
participación
will
respectiva.
make
El objetivo de la
presentations. The
reunión
purpose
de
of
hoy
this
es,
meeting today is
en primer
to
lugar,
firstly
sobre la
speak of
vulnerabilidad de los
the
pueblos
situation
indígenas
of
ante una
vulnerability of
emergencia
indigenous
sanitaria.
people in the midst
Luego,
of
por
this
otro
health
lado,
emergency.
identificar y
Furthermore,
evaluar
identify
algunos
and
de los
evaluate some
retos
of the
y
challenges that
desafíos
we're
que enfrentamos
confronting
actualmente
currently
en la
in
realización de
preparing
muchos de nuestros
and
proyectos que involucren
executing
pueblos
many of the
indígenas
projects that involve
y
indigenous
cómo es que
people,
estos
and
desafíos
how
de la
these
preparación de
challenges in the
procesos
preparation of
socioculturales
social
y
cultural evaluations
socioambientales
as
de
well as
desarrollo
implementation of
se
consultation
pueden ir
processes can
resolviendo
be
en
resolved
colaboración conjunta
in
con estos
cooperation
pueblos en
jointly
cada
with
uno de los
these
países
people in
latinoamericanos.
each one of the Latin American countries.
Empezamos con la
We
presentación
begin
del
with
señor
the
secretario
presentation
general
of
de
the
Servicios
Technical
Indígenas, señor
Secretary of
Alvaro
FILAC,
Pop,
Mr. Alvaro
que
Pop,
presentará
who
los
will talk to
desafíos
us
que
about
enfrentan
the
los pueblos
challenges
indígenas
faced by
ante el impacto de
indigenous
la
people
pandemia
with the
generada
impact of the
por
pandemic
COVID-19
generated by
en la
COVID-19
región
in the
latinoamericana.
Latin American region.
Seguiremos con la
And
presentación del
that
señor
will be followed
viceministro de
by
Asuntos
the Vice
Indígenas
Minister of
del
Indigenous Affairs from the
gobierno de Panamá,
Ministry
quien
of
compartirá la
Panama, who will
experiencia
share
de la preparación
the
del Plan
experience in
Nacional de
preparing the
Integración y
National Integral
Desarrollo
Plan
Indígena
for the
en Panamá
Development of
y
Indigenous
cómo es
People
que
in
se lleva a
Panama and
cabo
how
todo el proceso
the
de
whole
consultas
process of
en el
consultation
Consejo
took place
Nacional
with the
que
National
agrupa a los
Council that
representantes de
groups
los
all
territorios
the
indígenas del país.
representatives of indigenous territories in
Ciertamente
his
este
country,
proceso se
particularly
llevado
the
a
recent
cabo
process, which was
de
implemented
carácter virtual, en
in
donde
a
muchas
virtual manner
actividades de
where
manera dada la
that was
situación
necessary
de
as
emergencia
a result of the
sanitaria que
emergency
estamos viviendo.
situation and social distancing that we're going
Será
through at this
un
time.
particular
It will
ejemplo
be a
que
special
sirve
example
para todos
which will
los países de
serve
América Latina
all
justamente
countries of
por la
Latin America
preparación de un
precisely
plan
because of the
nacional para los
preparation of a
pueblos indígenas.
national integral plan for
Posteriormente
indigenous people.
tendremos la
That will be followed
presentación
by
de
the
la
presentation
consejera
of the
Adriana Lombarde y Sousa
Counselor
de
Adriana Lombardi
Rizomatics.
Sousa from Rhizomatics.
Rizomatics es una firma
Rhizomatics
consultora
is a
con mucha
consulting
experiencia
firm with
sobre
a
los
great deal
retos
of
de
experience
conectividad
on the
y comunicación en
connectivity
las
and
zonas
communication
rurales,
challenges in rural
especialmente con
areas,
pueblos
particularly
indígenas,
with
y
indigenous people
compartirá
who
una experiencia
she
muy
will share
reciente
a very
con
relevant experience
el estado de Puebla en
in the
México.
state of Puebla
Finalizo
in
la
Mexico,
presentación de mi colega,
followed by the presentation of my
señor
colleague from the
Milewski,
Gender and Diversity
hacia
Division of the IDB,
las
who will talk to us
recomendaciones que
about some
podrían
of the
seguir
guidelines that may
desde
serve
los pueblos
for
indígenas
governments and
para atender
indigenous
la
people
situación
to
de
respond to
vulnerabilidad
this
sanitaria
health
de este
situation
grupo por la pandemia.
for this group as a result of the
Reconocemos y
pandemic. We
estamos
recognize
conscientes que no hay una
and are
solución
aware of the fact
única
that there isn't
en
a
todas
single
las
solution that
circunstancias, en
can
todos los países,
explain the
ni
circumstances
en
of
todos
all
los
countries,
proyectos,
of all
ni
indigenous people,
a todos los proyectos
nor
en los
all
distintos sectores.
projects in the
Estamos
different sectors.
estos diálogos
We organize in these dialogues an enriching discussion where we can identify critical aspects and procedures that can promote an inclusive working manner with Indigenous people, respecting their uses, customs, and organization systems in each one of their own contexts. As part of the decision-making process to add to the design and implementation of the different programs. I'd now like to give the floor to my colleague, Juan Dumas, who will be in charge of chairing this meeting and controlling the time. Juan, you have the floor. Thank you, Juan. I want to thank the IDB for this invitation to facilitate and chair this regional dialogue with such outstanding panelists on a topic of such importance. I'd like to say that our agenda today plans an hour of presentations where each speaker will have 15 minutes for their presentation, followed by about 30 to 35 minutes more for questions and answers. And we're going to ask the participants to please, as David said, use the chat in the Zoom so as to send us your questions as they arise.
Nosotros se las haremos
We
llegar
will
presentadores.
transmit them to the speakers. And what we're going to ask the speakers is to make every possible effort to keep within the 15 minutes planned. And we will let you know through a private channel 2 minutes before your time is up. And once the 15 minutes, we will do it publicly. If part of your presentation was not presented, we will, of course, give you time during the questions and answer period. I'm going to go into English.
We would like to let people know that interpretation is available also in English in case you've just entered the room, and there's a button on the right-hand side in the lower end of your screen. Continuamos, entonces vamos directamente.
I'll continue now. Let's go straight into the presentations now, and we'll start, as Juan Martinez said, with Álvaro Pop's presentation. Álvaro Pop has a wealth of experience, and I wouldn't even attempt to read everything, but I can just say a few things about him. Álvaro is a Quechí family from Covan, Alta Verapaz in Guatemala. He's from the Mayan people, a politologist and an expert in international affairs. Since 2017 to date, he has been Technical Secretary of the Fund for the Development of Indigenous People of Latin America and the Caribbean, FILAC, and has worked for more than 20 years in defending the rights of Indigenous people. He was president in 2016 of the Permanent Forum for Indigenous Affairs in the United Nations. He's an expert since 2011 and vice president from 2012 to 2015. He's also worked in electoral observation missions. He's been an authority on different debates and in different national and international agencies. So, Álvaro, let's begin with your presentation so that you have the 15 minutes allotted. We have your presentation on the screen, and as I said, we will let you know when you have 2 minutes to go. Thank you. Álvaro? Thank you so much, and I want to congratulate you for this experience, for this dialogue that we're participating in at this time. We believe that it's fundamental to stop for a minute and consider the fight we're carrying out against the pandemic in Latin America and review the situation of Indigenous people in these times. A few weeks ago, we presented together with ECLAC the second report on the reality of Indigenous people in the region, a report which probably comes closest to the actual reality and coincidentally is arriving at a time when we're suffering a pandemic. I also want to announce that we're working with a group of Indigenous organizations and the governments of the region in what we've called the Regional Indigenous Platform against the pandemic, against COVID-19 precisely. This report was prepared with the help of two networks, the monitors, indigenous monitors of all Latin America, and the social communicators network of the region, and allows us to go into the innards of the continent and obtain the information which we will be presenting. The information brings us to understand the communities at risk. And I believe it's very important to begin my presentation by saying that we're talking about communities at risk. And in Latin America, the communities of highest risk are the indigenous communities. And what do we talk about risk what do we mean? It's the vulnerabilities plus the threats. Vulnerabilities being the situations in which indigenous people have been living in due to the deficit and the historical debt that prevents them from reacting in the presence of a situation like this. And the threats are those external situations, and the pandemic is an external threat to these communities. Their ability to react and to defend themselves in the presence of this health situation is very scarce, as in any other region in the world, and therefore, if we add the map of vulnerabilities plus the threats, we find ourselves in a risk situation. And in that respect, next slide, please. In that respect, we will find in Latin America a first very serious situation, which I would like to place on the table as the situation that is largely the life or death of a large number of people of huge territories where they live. First of all, we don't have accurate data. In other words, the statistics on the number of people who are being affected or infected by the virus is one which has enormous criticisms in practically all countries. But added to that, the number of indigenous people we don't even know without an identification. Practically no country in Latin America has an identification in the pandemic statistics, specifically the statistics of the pandemic, the number of indigenous people that are infected. It's not disaggregated in the official reports. However, we are obtaining information after the efforts of all our collaborators and all officers from the health ministries and so forth. We just discovered that 2 weeks ago, we had 7,246 indigenous people infected. And just in the last 2 weeks, we doubled that figure. And there are situations, as I said, where we do not have any information. We do know that at least in 10 countries, the contagion is massive. 847 indigenous people have died, 163 affected peoples. This is the map of the zones at risk. If we add, as I said, the vulnerability map to the threat, we have the risk. And these are the areas of highest risk in the continent, areas where the possibility of survival is minimum. Because the health conditions and the care conditions, just to give you an example, like the respirators, there aren't any in the rural areas. There are no respirators in the municipalities that are not the heads of the departments or that are not the capitals of the states in many of the federal states. Therefore, the possibility of going from a symptomatic situation to a situation in which their life is at risk and therefore require special medical care is practically a death sentence for these people. Hence, we need to identify the peoples at risk, and that's fundamental. And here we come close to it. And I say come close because I'm sure there's much more than this. The conditions to obtain the information at this time are critical due to the quarantines, but we have managed to establish these examples that are quite significant. 3 examples in Mexico, 1 in Guatemala, which is of serious concern, all the Chortí area and the band where the drought is intense due to the dry corridor. In El Salvador, these are soft peoples. 2 in Panama. The vice minister will tell us a little bit more in detail. In Ecuador, there are 3 peoples. In Peru, 1. And the conditions in Peru are extremely delicate, especially for indigenous people, despite the efforts made by the government to bring care to the most remote and rural areas and indigenous people in Chile, Argentina, Bolivia, and in the whole area of the Amazon, where there were fires, just barely coming out of the serious condition of the fires in the Amazon to deal with these emergencies, where obviously the conditions have become even worse. In Brazil, practically in all the indigenous people, there are problems, some worse than others. In Venezuela, in Colombia, there are trans-border situations, particularly those are probably the worst. So what are the main risk factors? This report we prepared, the second report, because the first one was just an understanding of the pandemic in Latin America for the indigenous people. This second report was considering the risks. We went to the risk community, but what are the risk factors? Some are the number of inhabitants. There are populations that are really minority groups that have 1,000, 2,000, 300, or 500 inhabitants, and a pandemic like this could simply put an end to the whole community. The second is the trans-border nature. There are situations like these people called Sofia, where they live between 3 states of the south of the continent, where the threat is very strong for these people. The epidemiologic situation, the prior diseases. At this time, in the rural areas where the indigenous people are, they're not only facing the threat of the pandemic of the coronavirus, we have dengue, we have other diseases. And on top of that, the non-communicable diseases like heart problems, diabetes, cancer, all of these which have never been treated appropriately. There's no second or third level care in these rural areas. The lack of drinking water. It's as simple as water treatment and elimination of threats like washing hands or using the alcohol gel. But that's not possible in these indigenous communities because there is no resources of these types, including drinking water. They have to walk long distances in many cases to pick up drinking water. So their conditions are extremely serious. The food insecurity, we're seeing white flags in many regions of the continent. And in some cases, these are indigenous people. But we're not seeing the situation realistically because many of these populations don't know that the message of hunger is to bring out a white flag. So what we're seeing are very severe urban situations. And then there's the stigmatization, a criminalization, the action of factual states like drug trafficking in many regions of the continent. So what conclusions and recommendations can we come to within the framework of an event like this? And this is what we get from the study. Some of them refer to indigenous communities who are at greater risk than a month ago. In Latin America, the speed of contagion is enormous, much more so than any other region in the world. FILAC, as an international unique agency in this type of organizations, because it's the only one having indigenous participation collegiate inside the governance, has been quite concerned and has established a dialogue between government and indigenous people. And we've shared these conclusions to say that the greatest concern is the growth of the virus, which is increasing in the continent and is advancing towards rural zones and indigenous territories, and is becoming ruralized, if you wish. We are going from the urban areas where treatment has been poor to rural areas where the treatment is going to probably be even non-existent. The state responses are insufficient, the vulnerability increases in quantity and magnitude, and the cases of stigmatization and discrimination obviously generate a problem that threatens the lives of these populations. The lack of specific information on indigenous people, as I mentioned, is expressed through state omission in the presence of critical situations, causing consequences that worsen the health and social crisis. The countries having some information may take better steps, and we see that as they have better information, the better the reaction and the intervention is better. So let's go to the next one.
In conclusion, many communities have prevented or decreased the spread of the virus based on the response by the people themselves. Health, food, sanitary, surveillance have also responded to the urgency, but also strategies to address the future. New problems need to be addressed, such as lack of supplies, criminalization, and the power of the non-state. Isolation is not a long-term solution for most communities. It is instead generating new problems, such as hunger, as I pointed out. We recommend that it be deemed a situation of emergency, the coordinated address by state institutions. It is necessary for states to overcome their lack of information. Plans must be executed and must respond to the emergency while also looking at the structural causes. We're actually talking about an heritage of centuries. It's not only from today. We need to promote good practices. We cannot confront the pandemic if we don't take advantage of the very good practices of the indigenous peoples themselves and also states. There are different experiences in different states that have been very useful, and important lessons can be drawn from them. In our continent, there cannot be a successful fight against the pandemic without a successful strategy for and with the indigenous peoples. The most important thing is dialogue with indigenous peoples. When it comes to communication and conveying information, there's a lot of information still lacking in the community. Internet, as our colleague will surely explain, because there is a company who is carrying out such experiments in the rural area, but we have no option for internet. A few municipalities in the continent have opened internet in parks or in public areas, and this has been very important, but it is still a desert, really. The percentage of access to communication are limited. Sometimes it's only with a radio in rural areas, and often it's a battery-powered radio. To save lives is today. To protect indigenous peoples is today. We have no time left. We can talk about mechanisms, possibilities. However, the protection was needed today. The tragedy is already occurring. Thank you very much for the time afforded me. Truly, the experience of confronting the pandemic amongst the indigenous peoples has been significant, and we're not on the winning streak. So international organizations need to take a look, and together with governments go through a three-party effort to try and better address the pandemic. Thank you very much. Thank you very much, Alvaro. You have provided the perfect framework for the next presentations that we'll be hearing, and we'll be able to deepen into many of the challenges and needs that you just described, for which we thank you. And thank you also for making your presentation in the allotted time. So thanks for that also. Moving on then, I'd like to now give the floor to our next speaker. But first, I wish to make a couple of housekeeping clarifications. Whoever has a question, please do so using the chat icon, not the Q&A icon. These two are on the bottom, these two icons, but we want you to select the chat icon so we can then respond to all the questions. The second presentation, the second issue is people are asking if the presentations and slides will be made available. And the answer is yes, they will be made available. Davis Jones will publish them in the chat for everyone to access. Now, yes, I'd like to offer the floor to Ausencio Palacio Pineda. Hopefully we can share on the screen his presentation. Thank you very much. Let me introduce Ausencio first. He's had a very interesting life. Ausencio was born in the Niove Bugle indigenous people, primary education teacher, conflict resolution. He's represented the Panama indigenous peoples internationally. He has been governor of the area of his indigenous peoples. He also sponsored the bill that gave rise to creating this community. He has been secretary of the coordinator for defense of natural resources and rights, the Canyobe people, and he held this position from 2009 to 2012, and the natural community in conflicts between the peoples and the government. As education, he has been chair of the Council of Indigenous Educators in Latin America. He was the executive secretary and member of the Ibero-American Council in Santa Cruz, Bolivia. He also created the Foundation for Indigenous Educators, and president of Association for Natural Resources of his community. He was elected deputy in 2014, or representative by the circuit of his area, twice president of the Indigenous Affairs Council, which is the National Assembly in Panama, and 3 times chaired the Indigenous Parliament and Afro-Descendant Parliament from 2014 to 2019. Today, he is Vice Minister for Indigenous Affairs at the ministry since July of last year, a member of the Fund for Development of Latin and Indigenous Peoples in Latin America and the Caribbean. Now, since we have 15 minutes, and we ask all participants who wish to do so to submit their questions through the chat icon. To my friends and fellow panelists, I'd first like to thank God for being part of the team and this family, and all of us enjoying good health, hopefully. And today I want to share some positive experiences of the indigenous peoples in Panama in the framework of this forum. First presentation, please. Panama has 7 original peoples. You can see the map of these indigenous populations. Of these 7 groups, it is in 12 different territories in the Republic of Panama, with a population of about 417,000 individuals in Panama, accounting for 12.3% of the total population. Let us understand what happened in the past when the government attempted to have a development plan in Panama. In 2009, we realized that the government wasn't doing enough, and we wanted ratification of the ILO Convention 169, but it was not possible when we realized that they wanted to exploit the mining field, the largest in the Republic of Panama. So in our group, we went to manifest and claimed our own rights. After several days of demonstrations, many people died or were injured, but finally on 15 March, we reached agreement with the government to establish a working group that, as stated in the agreement, included a development plan for the indigenous peoples. So in 2014, with talks with the government, we agreed on developing and establishing an integral development plan for indigenous peoples in the country, focusing on the social, economic, legal issues and needs of the groups, plus the governance of the indigenous peoples. This gave rise to a development plan. However, this development plan was also achieved through consultations, and the plan contains 3 main areas: the political, the economic, and social areas. These pillars have been developed even through the national consultation process. From 2015 to 2017, the consultation process of the 7 indigenous groups gives prioritization to the interventions needed in the territories when looking at public investment with support from the traditional structure of each individual indigenous group. In 2018, as a result of consultations and the prioritization process, a national development plan was developed for indigenous peoples. It was approved thanks to support from the World Bank. It was an 80 million plan contribution by the World Bank with a political and social component. In 2019, another project was approved, and within this same plan, to support the inclusive financing and indigenous entrepreneurship with the Inter-American Development Plan. This loan was $40 million. It has not yet been executed, but it supports the economic component of the development plan. Public policy to combat poverty in Panama, when there is great inequality. So in the legal and political pillars, the plan sets forth mechanisms that the UNDP that helped us in the consultation process also is involved in activities with the government to see how a legal framework can be established so that the plan may be deemed effective. Likewise, the World Bank provided support for the development plan. Under the economic pillar, we also mentioned that an agreement is being considered with the IADB to support the plan. In the social pillar, there was greater consultation to see how one could prioritize the basic needs of each indigenous group, and a number of projects were approved, and I will be discussing those momentarily. This is a satellite image showing how the consultation took place. What does the plan, what's it comprised of? It has a governance area where the vice ministry has to be strengthened. We have to strengthen the Ministry of Education to respond to the needs of indigenous peoples, also strengthen the health ministry when it comes to indigenous people's affairs, and strengthen coordination with the Ministry of Economy and Finance. Under the health pillar, the intention is to build health centers. All of this is being prioritized. There will be training for technical people and promoters to train a team also, to build an aqueduct and to build and rehabilitate health centers where the indigenous peoples reside. Under the pillar for education, prioritization was given the importance of bilingual training, to train trainers in the native languages, and also build some health infrastructure and education infrastructure, and also designs the expansion and building of aqueducts in indigenous areas in the 12 territories. Here we see a representation of the infrastructures that are planned. Let's look at the rationale of the system. This has been done in the framework of consultation with the communities. Under the prior free informed consultation law, we are confirming that the activities to be carried out in the territories must comply with consultation. It must be participatory. It must include the governance system, because one needs to understand that there are political authorities that have been elected, there are administrative authorities, but likewise, there are also elected people in the indigenous peoples, which are the chiefs and presidents of the councils, and therefore they need to be involved and participate with other authorities. There's a gender participation. It's important to have women present. Food security is also part of the process. Management of natural resources, which must also be considered in the plan. And furthermore, there must be competitiveness. All of this is thanks to participation and the suggestion and recommendation of authorities in indigenous areas. But at the same time, we must ensure its sustainability and capitalization in order to successfully implement the plan and that it may be effective in each and every community. This is an example under the economic component of support provided to Migo. It was thanks to FAO in order to have a productive investment in indigenous lands. And the report showed that it does yield a higher production when some technology is applied, but always availing themselves of the local technology. So this is an example of productions carried out in the indigenous lands, as I said earlier, with support from FAO. Now, how was all of this achieved? Well, it was thanks to coordination with the authorities of local people, with technical people, with the structure of the traditional government, in addition to the central government, as well as political will. This was not easy. These projects, these agreements, this consensus, and this working group it was all achieved thanks to a major effort after lots of people having lost their lives or been injured and even blinded, and many women were raped. So all of this suffering occurred first, and then finally we reached the point of being able to meet round a table and have a discussion. And it is this discussion that gave rise to the development plan for indigenous peoples. The National Council for Integral Development of Indigenous Peoples is an executive decree officially created. We already said that legally the decree is enacted. So work began. We had worked in a number of different areas prior to the COVID pandemic. Now, under the pandemic, as I was saying, prior to the pandemic, we met and we continue meeting, but we set up a strategy how to best tackle pursuing the priorities. Nationally, there are over 36,000 infected people. We're up to about 720 deaths. But when you look at the community areas, we see that infections are increasing. COVID arrived. I always say it was first to prove our patience and our strength, but also to impoverish poor people even further, to impoverish indigenous peoples. And the indigenous territories are those that are most affected by the pandemic. So, what did we do? Well, in coordination with the health ministry, we drew up an interinstitutional coordination policy. We created a multi-sectorial group for each territory so that the authorities could see how to best contain infection in the areas. Coordination with the traditional authorities was therefore important. We also noted that in some areas we needed to manage conflict between traditional authorities and government authorities, MINSA and the Ministry of the Interior, because some don't fully understand the traditional means or the government way to manage situations. So we needed to resolve this conflict. We also identified the health needs of each of the peoples. In this case, organized, prioritized, and coordinated with the traditional authorities. We also guaranteed an opportunity for dialogue with the political authorities and the indigenous people. We also rapidly set up meetings to follow through with the development plan and support pending projects. And there we noted that a virtual meeting would be necessary, bringing together all the authorities in order to prioritize the strategy to be used in this pandemic. So we looked at the facilitation of communications, giving priority to reaching agreement on how to best tackle food distribution in each area, how to have a security protocol for each area, how to have a sanitary hedge, and also to look out for volunteers and involve traditional authorities in each and every one of these actions and the traditional security of each territory. Minister, you have 2 minutes remaining. So as a result, after all our meetings, a fund for $2 million was approved. We proposed it to the council and the traditional authorities approved it. It will help mitigate the pandemic in indigenous territories and help us obtain necessary consumables. Before the pandemic, we used to meet, and it used to cost $25,000 to $30,000 to hold a session of the council. In the pandemic, the meeting we held, doing everything necessary with the invitations, complying with the protocol, convening the meeting, all those activities, the cost during the pandemic was $1,200. So we were able to make significant changes, but we were also able to support authorities so that they could join the platform, so that we were able to hold this virtual meeting and continue the work of the development plan, having our prior consultations with the communities and continue with all the consultations and all the interaction and supporting the territories in support of the protocol, traditional medicine, and everything else that's required. I believe that with this experience, we could say we are ready to continue working virtually with all indigenous authorities who support their communities, and we can reach out to them wherever there's a Wi-Fi allowing them to connect. So today, we must say that our experience is valuable, and the government in Panama and in governments in Americas can see how local authorities can be supported, because the work can continue virtually. They can continue supporting all activities and addressing the pandemic that has arrived and will remain in Panama to further impoverish the indigenous peoples of Panama. But we need our strategy, and here the traditional governance has been looking for the actions needed for greater involvement. And in each one of the territories, we want them all to be part of finding the solution, that they be part of making contributions and providing inputs, and also for the traditional doctors to be part of healing. In the indigenous territories, we have 960 impacted. 10, 12 indigenous peoples have died. However, there are many, many patients currently healthy thanks to local medicine. Thank you very much for this time, my dear friends. Vice Minister, we'd like to thank you. I realize that a significant portion of your presentation hasn't been covered because you have some very important practical recommendations. So let me suggest that when we begin the Q&A session, we go back to your presentation and give you some moments so that you may address those final issues. Do you agree with that? Yes. Thank you very much, Ausencio, then. Moving on then, I'd like to invite the next speaker, thanking all of those who have been asking questions through the chat room. Let us move now to Adriana Labardini Insunza. Adriana is an attorney specializing in public policy and communication and information technology. She's a counselor and advisor at Rhizomatica, working with community indigenous people. She was a commissioner at the Federal Telecommunication Institute from 2003 to 2018. She is founder and vice president of Connected. This is a network of women in the ICTs, and works also at UNESCO, designing public policy for radio and broadcast. She's a counselor of the National Institute of Communications. She has a master's. She's an attorney with a master's in law from the Columbia University in New York, a Fulbright scholar. And Adriana, please go ahead with your presentation. You have 15 minutes.
Thank you very much, Juan, and good morning to all of you and to everybody who's listening to us. And our special gratitude to the Inter-American Development Bank for this space and for emphasizing and make visible what we've wanted to visualize regarding the rights of indigenous people. Today, I would like to share with you the possible forms of resilience of indigenous communities from their own means of communication, particularly the case of the Tayo Chicahualis initiative, which means united with a strong heart against COVID-19, promoted by the Union of Tosepan communities in the northern mountains of Puebla in Mexico. And as we all know, the pandemic showed us the risks that have become a reality today of continuing to ignore the protection and preservation of the natural habitats of the biodiversity, the planet, and what happens when the ecologic balance is broken. The pandemic also showed the urgent need for indigenous communications to respond to the health alerts and environmental alerts in areas where the commercial telecommunication operators don't arrive, nor does the natural media arrive. COVID-19 is a call for us to become aware of the fact that human health is closely linked to and depends on the planet's health. The coronavirus family are zoonotics. These are viruses that are transmitted between humans and animals. They are responsible for 75% of all infectious emerging diseases. And to prevent future outbreaks, we must respond to the threats to ecosystems of the wildlife, the flora, the fauna, and even the loss of natural habitats due to the extractive industries, deforestation, the pollution, climate change, and so many others. And I'm not saying this, UNEP is saying it. And to this end, I think it's important that we highlight the strengths and contributions of indigenous people to preserve these habitats for hundreds of years. 80% of the biodiversity of the planet is under the protection of indigenous communities. And for this, the pandemic approach is one of the many actions of protecting the habitat and their ways of life. Their cosmovision includes the welfare of the environment linked to the welfare of human beings. Without the mutual care of everything there is on earth and above it, in the air and under it, there is no welfare. And that's why an important form of resilience of indigenous people in the 21st century is their own communications in their own varieties, platforms, radio dissemination, and telecommunication as an indispensable tool for the defense of the indigenous territory and their natural resources. information and the care of the persons and communities in the light of emergencies requires local solutions. I'm sorry, I'm having trouble hearing her. She keeps going in and out. If you wish, we can continue with the next. I actually should have shown these two slides first. Just as an example of what I just said and the importance of communication, of indigenous communications and the role they play in resilience, I'd like to share this experience of the Tayo Chicawali's campaign, which was planned in Mexico by the Navas and Totonacas communities grouped in a cooperative called Tosepan and Tatanisque in the northern mountains of Puebla. Next, please. The initiative Tayo Chicawalis tries to act on the basis of the organizational structure of these communities that for over 40 years have allowed them to build a good life project, which in Nahuatl is called Tecnamilis. Based on this initiative, communities have designed information actions to reinforce prevention, especially with persons that have vulnerabilities to this crisis, and collective actions, solidary actions in the communities themselves in the possibility of contagion and the enormous economic recession that these communities, who most of their income came from tourism, are now having to lose it. All this done through different communication campaigns to promote all these actions. For example, thanks to the Mexican state's policies of promoting indigenous communication, Tosepan has a radio station, FM radio station, and in the radio content done by the communities themselves, including radio clips on traditional medicine done with Radio Tosepan, or maybe healthy food through other means like internet and other information technologies. Tosepan has been able to play important roles during this pandemic. First, the redescription of the health policy of the government without disregarding the calling of the state and federal authorities of remaining at home. The initiative of Tayo Chicawal goes into greater depth of what they call strengthening the heart and be solidary and help each other with the appropriate distance. To strengthen the heart goes far beyond simply individual isolation or care. There's collective care, there's protection of the most vulnerable, but also there's the need to protect the autonomy of indigenous people to increase their resilience and the resilience of their economy in the isolation. And not only have they created a series of prevention messages in Nahuatl and in Spanish, as part of the campaign, they have also coordinated with the state's information as a complement so that in these radio clips that are being transmitted on the radio, you first hear the messages from the Health Secretariat of the federal government, followed by, in the radio program of Radio Tosepan, there are comments and an analysis of the data and placed within the context of their own realities and their own life, of the Totonacas and others. And often the messages and the callings of the federal authorities are developed within an urban context for large cities, which is not within the actual community context. They've also been able to create internet community internet messages, as I mentioned, and aside from the radio contents, the community is in the process of creating a wireless 4G network of their own with the support of another Indigenous association with Indigenous Community Telecommunications. They already own a cellular telephone network in the mountains of Oaxaca, connecting and communicating with voice and messages to 64 communities, Indigenous communities. This project includes an intranet network with its own content and in reference to their communities. It's not only their own structure, there's also support and funds to create content in different languages which are relevant to them. And we see the radio in action and the work of the communities, learning to set up and operate their own networks. Next. No, she apologized. Let's return to the slide before. This is a project of free access to inter and intranet. It has been done with an internet provider, a wireless provider, WISP. It's called WAC Week and the financial cooperation of Tosepano. And they have a series of links to transfer money with the correct respect to the autonomy of the Tosepan communities. Through this partnership, they seek to offer wireless services to expand the service to 430 communities that set up the Union of Cooperatives of Tosepan with the single concession granted by the Federal Telecommunications Institute in the state of Mexico and the TIC concession, which is the provider of cell phone telephony. And this is a small example, we have others, of the relevance of the media in the light of current and future risks. When we analyze the role played by these indigenous media in the Tayo Chicawali's campaign, we see the importance of the media to place the priorities and local messages, because the federal public policy of the state sometimes is coordinated, as I said, within a context. Thank you, Sergio. We're having a really hard time listening to her. We have to respond to the causes and strengthen local resilience with the long-term perspective. This terrible juncture, which was the pandemic, has allowed us to advance towards new paradigms, long-term paradigms, to restate all the possible interactions of how the states are going to respond to the rights of the people, promoting resilience in the internal community organization and the economic resilience and the self-sufficiency, and how to respond to threats to natural resources or health emergencies, and the territories and members of the indigenous communities. That's why the media are key for this. As long as there are local contents in their appropriate languages, which are relevant for them and their expectations and needs identified by the communities themselves. There's a coordination in the emergency with the health authorities, which is important, but always enriching the appropriate policies and the forms of community life, which makes these people actually resilient. But to become a reality, the indigenous networks and media require that the states eliminate a series of barriers and public policies and introduce truly enabling policies that will ensure that the people have their rights with their own communication media and self-regulated in their own territories, as per Article 16 of the Universal Declaration of Indigenous People. That's how they should proceed. Evidently, without the indigenous media, it would be much harder to ensure effective compliance of the rights of people to be consulted and participate in policies that affect them, as indicated by the Convention 169 of the ILO. Personally, without the networks and the communication media from the indigenous localities themselves, it's impossible to even consider the possibility of indigenous consultation through electronic means, for they would automatically be excluded. Thousands of localities and people would be excluded. I'm not even talking only of Mexico. I'm talking of all indigenous people if they don't have their communications media. And this is why it would be impossible to consider that a state is actually complying with its right to offer free, informed, and fair consultation when their telecommunication policy has not responded to Article 16 of the rights of indigenous people to be consulted and have their own means and access to conventional means. And the state, if the state does not generate the appropriate conditions that allow these people to acquire, administer, and operate their own communications media, then we would be unable to think of actually digital consultation of these people. Adriana, it's time up. Your time is up. I'll end, if you allow me, by mentioning the 5 or 6 necessary public policies to enable the indigenous people, first, to have detailed information on coverage or lack of, as per each indigenous rural community, access to frequencies of the radioelectric spectrum without licitation, without bidding or payment, innovative shared use policies of the unused spectrum in the rural areas, to have a simple and speedy and free system for registration and licensing, specifically for networks and community media. Affordable access to the backhaul, such as fiber, satellite, or land links to relate these. Redesign the universal service to support local economies who wish to invest in their own community infrastructure. To create technical training funds for men and women in the community so that they can learn to set up and operate their own networks, and to create and encourage the orange economy, in other words, the cultural economy, allowing men and women to create their own content and applications, disseminating and preserving their language, culture, and art. Next. This is just to give you an example of a title for concession of indigenous media. And finally, to express my gratitude for your attention and your time. Next, please. And to tell you that in those links, you can see more of the actions and enabling community regulations. Thank you. Thank you very much, Adriana. As people are asking, are we going to offer these links and make these presentations available, and even the recording of this meeting? I want to repeat and confirm that yes, you can find in the chat the link to Spanish or English so that you have access to all these presentations and to the recording of this event, of course, after it concludes. And all the presentations have been uploaded. Thank you very much, Adriana. And we're now going to continue with our last presentation, Ana Grijera. Ana is an anthropologist trained in the United States and France. She worked and studied to practical integration of interculturality in public programs and policies geared to health, conflict resolution, migration, education, and economic development. She's currently working as a specialized consultant in territorial development with identity from the Gender and Diversity Division of the IADB in Panama. She supports different sectors of the IDB, roadway infrastructure, education, health, and economic development to strengthen the participation of indigenous people in the formulation, design, and execution of operations and public policies. Ana, we'll continue with you. You have 15 minutes. Thank you very much. Good morning, and it's a pleasure to greet you all. And thank you for this opportunity to share this experience with you. My presentation of communication and coordination with indigenous people in times of COVID is based on the IDB's experience in preparing communications material for prevention, contention, and management of COVID in indigenous territories since March, and through highly participative processes with the indigenous people of the region. Specifically, the results and the products we'll share include a technical note addressed to strengthening coordination amongst indigenous people and governments, a community guideline, a technical guideline for prevention and contention of COVID, a matrix of reference materials of indigenous people in COVID for indigenous people as well as for the governments themselves, a community guideline with a video of COVID prevention and some radio ads. The last two have been translated into 15 languages. The methodology to prepare all these materials was based on an exhaustive analysis of materials the indigenous people were preparing throughout the region, protocols, communiques, declarations, videos, as well as a review of the official material that was being produced by the international agencies as well as the government. In that exhaustive review, we can identify two critical areas where we can pay special attention dealing with the generation of inputs in response to coordination challenges between the government and the indigenous people and communications on COVID for the indigenous people in this health emergency. The preparation of the materials included dialogues. Aside from the review of the literature and the materials, dialogues were held with the authorities, the indigenous authorities nationally and indigenous organizations regionally, as well as the participation of indigenous professionals and expert organization in intercultural and bilingual education in preparing all these materials. So based on all this journey, we wanted to share some considerations which we felt could strengthen communications and communication and coordination with the indigenous people in light of COVID, since this is our new normal and will be relevant for the health responses as well as for consultation purposes. So I'd like to first highlight certain key concepts or considerations, and then I'd share some of the tools with you. First, one of the key elements in preparing the communications material or to respond to one of the key challenges within the context of the pandemic for indigenous people and COVID is communication and coordination with indigenous people. The indigenous people are one of those groups that are most vulnerable to COVID and a very high risk of contagion, morbidity, and mortality with pre-existing inequalities, such as limited access to basic services, water, health, poverty, pre-existing diseases. All these significantly increase the risks. Furthermore, when having to intervene in indigenous territories, the health emergency response becomes complex because of distances, the difficulty of access, the availability of equipment, or resources. So all of these are elements that show how important it is to pay priority attention to the indigenous people and territories and to coordinate with them to prevent the spread of the virus with adequate management and contention of the disease. In the review, we constantly saw the need for strengthening this communication and coordination amongst indigenous people and the state. And maybe that was probably the most important thing we found with a review of the literature of prior experiences or studies of the impact of past epidemics on indigenous people. That was always mentioned as one of the lessons learned or one of the aspects that had to be or should be considered in any health emergency. Strengthen the coordination and communication with indigenous people. And another important aspect of coordination and communication is the need to have information about COVID in the languages and with the relevance of these indigenous people. The difficulty of accessing information in their own language was one of the mentioned challenges throughout these last months. The people and the governments have been generating material in the indigenous languages, but as we know, there's a new reality each day and there's new information every day. And it's important to try to keep that communication aspect on COVID in the languages of the indigenous people themselves. I also think that it's important to mention that the people themselves have responded by generating their own prevention material in their own languages, which represents a clear opportunity of how, through greater coordination between the government and the people, to facilitate that generation of information and aspects of prevention in the languages of in their own languages. The need to strengthen the communication channels and the coordination mechanisms is also critical, which has to be comprehensive with all the institutions that participate in the different territories. It's not just the health authorities we're talking about. As the second consideration is the differentiated intercultural and practical approach. I was mentioning the importance of information in the indigenous languages, in their own languages, but to generate relevant material goes beyond the simple translation of protocols or measures. It requires an adaptation of this. And from our review of the literature and our dialogue with the authorities, we found three key words: differentiated approach, intercultural, and practical, to really adapt it to the needs of these communities. For example, or I ask, why is this adaptation need so important? It was mentioned that there were several measures recommended which were not necessarily applicable, that actually created confusion or even generated problems. And I'll give you an example. In the standard recommendation of hand washing, which are not always applicable to those communities who do not have the water resources or the soap or the gel. So what should they recommend in those cases? And also, they recommend social distancing. And that's something that in certain community contexts could be either difficult or almost impossible to apply, where there are large extended families or where the traditional housing would not allow for that type of social distancing or separation. So those are the things we have to consider. What would be the ideal measures for those contexts? So when we adapt these to their needs, it must be based on the national protocols, but adequately applied to the actual circumstances of the indigenous community. Also, an adaptation has to refer to language, not just, it has to be colloquial language. It has to be using the appropriate terminology. In other words, using their tongue, using the appropriate word. So for them, the mention of virus is calling the virus. So it would be probably rejected if it was mentioned in some communities. So just as an example, I want to give you certain elements that show how important it is to understand the prevention information from a differentiated point of view. It's not just a question of considering the dominant society or the majority society or the non-Indigenous context. It's also important that this diversity of context be considered to prepare measures for these diverse contexts. Also, we must always recall that from the wealth of diversity in the Indigenous people, where there's more than 700 different people in the region with their own language and political and cultural and geographic differences, things that have to be taken into consideration as well in the communication and coordination actions. The intercultural aspect must always take into consideration the applicability in the specific context of an Indigenous group, and the adaptation of the material or the development of material would require that additional team effort between the Indigenous people and the government. Another important element to be borne in mind is the practicality, the importance of generating official information brought down to the community reality in a way that it's easy for them to apply and that we don't end up having what I mentioned before, a measure that they don't know how to apply, or a measure that means that they should not leave the house, but then they don't care for the crops or generate a future problem, for example, of food security. So I think that we have to consider all these elements when we generate the measures or communication that is relevant for their situation. In summary, I think it's a question of making an effort to understand the community reality when developing communications materials. Another key consideration is recognizing the social and organizational situation in the dialogue between the Indigenous communities and the government. You can clearly see the challenge of Indigenous people not understanding the governance structures and the organization systems. And it's very relevant for coordination and very relevant for promotional tools or communication tools. When we see the promotional material for COVID prevention in a non-Indigenous context, an approach of the individual is focused. You must do this, you must wash your hands in this way, you must do things in this other way. But in the Indigenous communities, it's important to understand the community element. True, these recommendations are fundamental, but it's also important to understand that these measures and this information must respond to the family nucleus, to the usually very large extended families, and also their own governance structures, which are actually going to be the first line structures determining whether and how they can actually apply the prevention measures at a community level. I'm sorry, Anna, you have 2 minutes left. Oh, okay, thank you. Okay, then to close my idea, to end, I think it's fundamental that we consider the organization and governance structures of Indigenous people. And as for participative methodologies, another thing that is fundamental to include in the coordination actions, particularly in the development of communications material. I wanted to share very quickly some of these tools that we've prepared and to highlight in particular a video that was prepared in 15 languages for the translation of that script into the different languages. 3 native speakers of each language was hired to review the script and actually adapt it socially, linguistically, and culturally to make sure that the message itself could really reach the community or the actual territories.
This is just one example of participatory methods, as well as the efforts required to develop bilingual, intercultural, and effective instruments. So very briefly, I'd like to share with you video animation, and this will be in closing of my presentation. Here we go. So this is a video animation based on community ideas to broadcast on social media and other means. There is a comprehensive strategy for the broadcast of this information about COVID prevention, including community radio, social networks, and media, governance, etc.
Coronavirus kan wani alei hawa mai masin pak maka para tare shatas wala ka hin kanai karioto le otta shaudu para tas wanai maka wepete chikanai ma para ter siang nai ubuna wenchi sia u ayawa tens piama pa o piama i pienchi pakai nai wayu kashouras leches ono ai semura mustapa siarin iki totta motstu hai ton se wai kuram sia wai sara hirai hurio iker hana hina waya epuna iha wali hatu ya kashpuna ula wa tinki kwa huitere wa piar uhe goro huinti wa hap ka win mashpuna no rintu wa petti wa puna huma yarti wa hap ure watuma wakotisa otta washiha ma tin washen wanainga na hutta ure hatu pia okai no ru ingene irai waya ka waripia waitai otta wasia imatu ingene wai pia wa kushwa wana huma ai mahira wa munaka wataru ingene waya huri wayu tawa ingene saka oture no ru ingene yo kan wai wapi ingene wayu era kan pia seka otta erhe ingene waya ya are ya wakan punti ring wayu e punaria uria wo tuindia wahira tu pain wahira waya hunai ami hatu wai sara hitai tu hain tawa kwat e hatu nai na ulaula yu kana ma kushia na yuri kula e hatu wai huture wayu wa utpa hai tau nakat kok menarik ya waktu dulu hai tuai wayu antaka usia ayu la karung mai ru hebu dia hun tirare ya waka no ru hana o nui waya ali huna pia pa he rum mai pa magaer dan takari huna pia pa he no ru tarut ke pula puna olo yenchi kai Hawamang na yon na hira remai mengwayu kunai uri hatu huara kami are ya hawaka ke masia mati ayatin hana waya tai raha wa ruleka punaha oroho nama ne wayu we pia hanaka haria chona raula yu karushia na yu na ya mai ho kan pura re hawa da tu ana we queen ko do witush pura katsuni waya kali han kai ku na wayu mama hanaka tak get tai ba hui da hu dia hon namu le na hu la yu kan ma ayat tin hana ne waya isa la hirai maka wa ke tare ya wa ka tu kama ya sa wai ma hirai hana wa kushwa e wo mai no mo oh ya ho wa
Muchas gracias, Ana.
Thank you very much, Ana. And thank you for the presentation and the video. That really is a very nice tool and a wonderful process to bring it together. So we have now about 25 minutes to have a Q&A, but at 12 o'clock Washington time, this Zoom meeting will end. So we have about 20 minutes, I was saying, for Q&A. Let me start with Alvaro, but first let me inform everyone that the link to Anna's video has been published in the chat by Davis Jones, so you can download it and view it on computers at leisure. So let us now go through the questions. I would like each of you to have perhaps 5 minutes to answer 2 or 3 questions. In your case, Ausencio, I would like you to have the opportunity to present the final slides of your presentation, because I think you have some valuable and useful information that you can share with us. So let me begin with Alvaro. I have a number of questions for you. Let me begin with 2 of them. The first, how can one address the vulnerability of indigenous peoples in urban and metropolitan areas prior to the pandemic? That is question 1 from Mauricio Nastroza, Social Capital Group. There's also a question by Eva Buendia from IDB Spain Co-Financing. How can FILAC and the IDB work together to have an impact on investment programs and projects with considering ethics and human rights, thinking about green bonuses, other types of safeguards, consultations, free informed consent, informed approach, and cross-border impact. So let us begin with those 2. Alvaro, 5 minutes, please. Thank you very much, Juan. Quite honestly, there are many questions. I have read them all. Some have already responded in the chat, but I'll be as brief as possible because 5 minutes is impossible to cover everything. So let me take up a few extra minutes, taking advantage of the tradition. There is a question, in addition to the one you've mentioned, one referring to drug trafficking. There are countries where drug trafficking is a factor of risk for indigenous peoples. The answer is yes. I have put a link to the second report that talks in greater precision about all the information that I presented. Mexico, Guatemala, Honduras, El Salvador, Colombia, Peru, Bolivia, Brazil are some of the countries for which we have exact data about the risk situation due to drug trafficking. Risk factors in urban communities, yes, the factors are similar. The difference is they cannot be mapped, with a few exceptions such as Peru. How can FILAC and IDB work together? Excellent question. Let me tell you with great satisfaction that we created a technical group at the request of FILAC, the Fund for Development of Indigenous Peoples in the LAC region, a technical group to work and find joint opportunities with the World Bank, IDB, and FILAC, through which to establish mechanisms for action, confinement, etc., etc. And we need to look at the loans granted to countries to palliate the economic impact of the pandemic and establish protocols for safeguarding specifically issues in each country. Coordination can be in general terms, but it can also be in specific areas. And what is speediest is to look at the size of loans or to review each loan granted country by country. It is our understanding that the World Bank and IDB have worked hard and opened the possibility to obtain loans, foreign debt, etc. And I believe this needs to be tackled. It's necessary to even finance dialogue between indigenous peoples and governments in each country with a very specific strategic agenda. And FILAC can help coordinating because we have both governments. And in FILAC, we have the indigenous governments. We are the only international entity with all the privileges, immunities, and so on, with also indigenous participation and their governance structure involved. And FILAC and IDB can comply with the different safeguards that have been established and approved by international organizations. We can support, we can assist, we have the structure, the knowledge, we have the traditional interlocutors, and that will allow us to work. I believe that with the goodwill that we've already seen and that we are further developing, we'll be able to make good progress along those lines. There has been another question about distance. Distance are a factor of vulnerability. Somebody asked that, especially for the Amazon, when only by helicopter or by launch in the rain season that they can be reached. Why did I select this question? Well, because caring for indigenous peoples is very expensive today. It's very onerous because they are in remote areas, they have tremendous needs. So what can I say? Well, first, the states need to invest in caring for the people in their territory. That is expensive, yes, but the cost has to be accepted. They need to be indebted to respond to the emergency, yes, absolutely. The post-emergency, there'll have to be a fiscal review of the process, because what the pandemic is showing us is that there are states that are extremely weak, especially when it comes to fiscal matters. They cannot provide coverage. We need to strengthen the governance processes in the community and the very mechanisms for prevention and treatment. We don't have to reinvent the wheel. We need to help the community do what they believe is necessary and address the needs based on their own requests. Take advantage of community radios. Very many countries don't want to hear about these radios, but they are fundamental. It is sometimes the only expression, the only means to establish communication. There needs to be an alliance with institutions in the territory, such as churches, NGOs, and we need to avoid the segregation that is often ideological, absurd, and even foolish to benefit indigenous peoples. We need to reach them by any means possible at whatever the cost. People are dying of hunger, dying of disease, dying due to COVID in particular also. We need to ask, we need to honor the commitment. We need to ask the peoples. Frequently from our desks, we believe we have the right answer, but I think we need to know how to listen, to ask the communities what do they need. What about the traditional knowledge and traditions? These have been a very useful element for prevention and to palliate the first symptoms. However, they are insufficient when the needs are for intensive care. They're absolutely insufficient. When it comes to communication, taking a leap, and I don't know if there'll be a second round, yes, the idea is to have a second round if we all abide to the time allotted. So maybe you can close here and I can move on to Ausencio. Thank you very much. Thank you, Alvaro. Ausencio, let us then see your last slides. I think it was slides 23 through 27. They would be very helpful, I believe.
No sé, Patricia, si lo puedes subir la presentación de ausencio. Gracias. Ahí está. Hay un problema con el audio de ausencio.
I think we're having problems with audio from Ausencio.
Adelante.
Sí, es necesario señalar que formales, nosotros hacíamos el Consejo de Desarrollo Indígena, la Asamblea del Consejo de Desarrollo Indígena presencial, y establecíamos varios puntos que teníamos que desarrollar. Por ejemplo, la convocatoria formal de la agenda de trabajo que había que hacer, preparar los documentos técnicos, habría que ver un poco los pagos de movilización de los 48 miembros que componen el Consejo, reservar los hoteles, alojamiento, alimentación para ellos, salón de reuniones. Todo esto lo hacíamos en la ciudad capital. Enviar borradores de resoluciones a las autoridades y a los técnicos, elaborar instrumentos de comunicación sobre la misma cobertura del Consejo. Pase, por favor. Si podría pasar, por favor. Y luego, entonces, ya ha llegado el momento, la acreditación y todo lo demás, y se desarrollaba, y eso costaba más de $25,000 a $30,000. En tiempo de COVID, luego se cumple también lo mismo protocolo, con la siguiente dinámica. Convocatoria por plataforma virtual, Microsoft Teams, compra de tarjeta de acceso a Internet y reconocimiento de costo y movilización mínimo a las autoridades y los miembros de los consejos, lectura y aprobación de la agenda, debate de los temas importantes que se ve en el Consejo de manera rápida, de acuerdo a los reglamentos que establece el Consejo, revisión y ajuste y aprobación de las resoluciones que se está discutiendo en los consejos. Pase, por favor. Pase, por favor. Y entonces nosotros se envía las copias de esto a las autoridades y luego se hace la misma convocatoria de manera virtual. De hecho, estos trabajos que estamos haciendo de forma virtual, donde se conecta cada territorio a la plataforma, nos cuesta lo mínimo $1,200 a $1,300. Es decir, abarata un poco el costo, la realización del consejo de forma virtual que el consejo que realizábamos de manera presencial. Pero yo quiero dar un énfasis. No sé si me podría poner la presentación, la plantilla 14, por favor, para cerrar eso. Por favor, si se puede. El número 14. Sigue. El número 14. Sigue. Por favor, sigue. Más. Ahí. Gracias. El Consejo Nacional o la Asamblea del Consejo Nacional de Desarrollo Indígena, donde están los 7 territorios, donde están las 12 estructuras tradicionales, el Comité Asesor de Mujeres Indígenas, que está dentro del Consejo, y la representación del gobierno, ¿qué es lo que se hace ahí? Se hacen las consultas pertinentes. Se propone, ¿quién propone? Las autoridades tradicionales. Ellos deliberan, debaten, priorizan, concertan, porque también ha encontrado varias recomendaciones y propuestas, entonces llega a un consenso y decide. Y luego de haber decidido, entonces nosotros sometemos a la consideración para la votación. Y el que tiene mayoría de votos, muchas veces, mayoría de votos es el que se decide, se aprueba la estrategia, la propuesta, el plan de acción, etcétera y etcétera. el programa, en este caso de COVID, el programa de cómo atender a las comunidades, cuál es el plan, cuál va a ser la participación de las autoridades tradicionales en el marco de contención a COVID, cuál va a ser la forma de cómo sacar los voluntariados, etc. Se discute, se planifica. Aquí en el Consejo es donde la población originaria toma la decisión. Nosotros como representación de gobierno, nosotros dirigimos nada más, pero se hace a través de una votación. Entonces, aquí es la participación de las consultas previa, libre e informado de las comunidades. Además de eso, las comunidades se empoderan. Ellos son los dueños para tomar las decisiones. El gobierno, una vez tomado las decisiones, da seguimiento y cumple con el proceso de las aprobaciones de las acciones que se dan en este consejo. Es importante señalar que este avance que tenemos es como un pequeño consejo de gabinete indígena en Panamá, donde se establece, se planifica la política pública para desarrollar en los 12 territorios para los 7 pueblos originarios del país. No sé si completé la información.
Excelente, sí, Ausencio, muchísimas gracias y en 5 minutos exactos, así que de verdad, muchas gracias y creo que valía la pena abrir este espacio adicional para poder ver estos elementos muy, muy importantes de su presentación. Gracias. Quisiera pedirle entonces a Adriana si pudiéramos responder algunas de las preguntas que te han realizado. Voy a leer 2, si te parece bien. La primera es, el sistema de comunicación es una experiencia crítica durante la pandemia de los pueblos indígenas y es importante diseñar el sistema de comunicación satelital para el manejo y alerta de las pandemias venideras en las comunidades muy alejadas de las ciudades. Muchas gracias, es el ingeniero Samuel Cauper del pueblo indígena Shipibo. ¿Qué opinión te merece su comentario sobre los sistemas de comunicación satelital? Esa es la primera. Y la segunda existe en el diseño de estas plataformas la opción de que los privados puedan aportar a las comunidades indígenas en el marco de potenciar estos medios. Sería como un camino de pérdida de independencia para los medios comunitarios. Si puedes responder esas 2, gracias.
Sí, gracias, Juan. Bueno, desde luego, todas las tecnologías pueden sumar y ser importantes, sea un sistema de satelital para transportar las señales desde la comunidad, pues llevarlas y transportar el tráfico. En otros casos es fibra óptica, en otros casos importantísimos son enlaces Wi-Fi, que es un espectro de uso libre, y en otros casos enlaces de microondas licenciados. La cuestión es que en cada caso se haga un diagnóstico de las necesidades y preferencias de la comunidad decididas por ellas, las características topográficas, geográficas, dónde están las redes de transporte más cercanas, si es selva, sierra o costa, los costos desde luego. Entonces tiene que hacerse un análisis integral de las posibilidades tecnológicas, las necesidades de capital, los costos de operación, pero sobre todo las preferencias y necesidades. La comunidad prefiere una comunicación verbal, o sea, voz. No todas quieren internet. Les preocupa la invasión de contenidos comerciales que los desculturalicen y que solo propicien el consumo masivo. Otras prefieren mensajes de textos o tener intranets con universidades como en la Sierra de Oaxaca, universidades con contenidos locales. Pero en fin, sí, por ejemplo, el Estado mexicano le donó a TIC, Telecomunicaciones Indígenas Comunitarias, cierta capacidad satelital que usará TIC para sacar el tráfico en caso de que su red de transporte se caiga. Y eso es algo que los estados podrían apoyar, dando capacidad satelital para el transporte, sobre todo en las zonas más aisladas. Hay casos interesantes, tanto en México, en el río Napo de Perú, de redes Wi-Fi, celulares, pero en todas se necesita sacar ese tráfico de la última milla. En el otro tema, nada más antes me gustaría mucho abordar esta parte de cómo es la capacitación de la población indígena. Sí les comparto que es una parte importantísima, que en redes hace .org.mx tenemos una serie de materiales de formación de comunicadores indígenas. Ha habido con la UIT, con universidades, con sociedad civil, diplomados de capacitación en lo que es la comunicación indígena, tequio comunitario, haciendo milpa, con recursos en la producción de contenidos y también capacitación técnica para programar con software de uso libre, para instalar y operar redes. Y esta parte de formación es lo que empodera, lo que les da independencia, autonomía a las comunidades. Y ahí, por cierto, y me parece muy útil, lo dejaré en el chat, la Asociación Redes hizo todo un manual de atención de emergencias. Es guía rápida para radios comunitarias en la atención de emergencias. Es una guía de cómo comunicar, cómo alertar, un protocolo, y está también disponible en redesac.mx. Es un esfuerzo, creo, importante. Y hay muchos recursos formativos e informativos en redes, en Rizomática. En cuanto a la cooperación de los privados, no sé si se refiere a operadores privados comerciales de telecomunicaciones. Claro que puede haber esquemas de cooperación híbridos. Una forma importantísima de las grandes compañías de telefonía y banda ancha móvil es que compartan el espectro que no usan en zonas rurales. O sea, adquieren licencias de 20 o 30 años para usar el espectro, solo lo usan en grandes urbes, pues es donde es rentable, lo entiendo. Pero queda inutilizado una gran parte de espectro, y eso pasa en todo el mundo, en zonas rurales, que podrían compartir, y que una política pública debería de ser, usa o comparte el espectro, porque todo el mundo pierde si el espectro queda inutilizado. Y por la lejanía de estas comunidades no hay riesgo de causar interferencias a los sistemas celulares. Entonces esa sería una muy buena política de compartición del espectro, porque la tecnología hoy lo permite. Y hay una serie de modelos híbridos, pero sí es importante que no sea una nueva forma de colonialismo, de que pierdan sus lenguas, su cultura, de que propicie un consumismo. Creo que hay modelos autónomos que preservan la cultura, la lengua y la autonomía indígenas, y lo que creo que es importante es que haya políticas de compartición de infraestructuras para no duplicar, no elevar costos.
Perfecto. Adriana, perdóname, te tengo que cortar ahí.
Perfecto.
Discúlpame, gracias, porque nos quedan solo 3 minutos para el final. Ana, el video era muy bonito, pero nos tomó un poco más tiempo de lo previsto, así que te quiero pedir si por favor puedes usar 1 minuto para hacer un comentario de cierre, y luego ya le pediría a Juan Martínez que cierre para nosotros. No, está tu audio cerrado.
Sí, rápidamente respondo a 2 de las preguntas muy rápidamente. Uno tenía que ver con la brecha generacional. No tuve tiempo de mostrarles todas las herramientas, pero hay una herramienta, una guía pictográfica, una guía técnica, el video de animación que vieron y cuñas radiales, con la idea de tener productos comunicacionales que pueden ser diseminados por diversos medios a diversas audiencias, incluyendo diferentes audiencias a nivel generacional. Y en cuanto a la integración de lineamientos de autoridades sanitarias a nivel mundial como la OMS, efectivamente, no lo mencioné, pero el equipo del BID integró, es un equipo interdisciplinar con especialistas de salud, quienes aseguraron que todas las recomendaciones que se estuvieran dando alineaban con las pautas que están establecidas internacionalmente. Muchas gracias.
Muchas gracias, Ana. Entonces, quiero agradecerles a todos, y me gustaría pasarle entonces la palabra a Juan Martínez, especialista líder de la práctica social de la Unidad de Soluciones Ambientales y Sociales del BID, para que cierre este diálogo. Muchas gracias, Juan.
Muchas gracias, Juan. Bueno, desde el Banco Interamericano de Desarrollo, a través de la Unidad de Salvaguardas Ambientales y Sociales, quisiera extender mis agradecimientos por su participación a esta 5ª sesión de la serie de diálogos públicos regionales sobre políticas ambientales y sociales de la región latinoamericana. la cual, como pudimos apreciar, se enfocó en los retos sociales, ambientales y sociales que enfrentan los pueblos indígenas ante la pandemia generada por COVID-19. Agradezco las excelentes presentaciones del secretario técnico del FILAC, Álvaro Pop, quien presentó los resultados relevantes de los múltiples estudios que están llevando a cabo desde el FILAC en coordinación con otros organismos internacionales como la CEPAL. Evidentemente, sí, el FILAC siempre es un colaborador muy importante para el Banco Interamericano y con quien extenderemos nuestra colaboración siempre. Agradezco también la presentación del señor viceministro, que es un ejemplo realmente para toda la región de cómo los pueblos indígenas pueden trabajar concertadamente con los gobiernos nacionales. Y él en especial, que es el señor es viceministro de Asuntos Indígenas dentro del Ministerio de Gobernación. Y su excelente presentación sobre el Plan Nacional Integral del Desarrollo de los Pueblos Indígenas. Se resalta realmente la experiencia de que sí se pueden llevar a cabo este tipo de diálogos concertados con pueblos indígenas en esquemas virtuales, siempre y cuando se puedan respetar los protocolos establecidos por los propios pueblos y bajo sus propios usos y costumbres. También extendemos nuestro agradecimiento a Adriana Lambardini y Sunza de Rizomática y su experiencia con los pueblos indígenas náhuatl en el estado de Puebla y toda la presentación de los desafíos y retos de conectividad que enfrentan los pueblos indígenas y cuáles serían como las diferentes aproximaciones a soluciones que se puedan dar en contextos de colaboración conjunta entre los gobiernos nacionales y también los diferentes pueblos indígenas. Finalmente, la presentación de mi colega de la División de Género y Diversidad del BID, Ana Griguera, y aquí me gustaría resaltar la permanente colaboración de la Unidad de Género y la organización de este diálogo regional. Este diálogo realmente fue, y gracias a todos los panelistas, fue realmente gracias a la puntual colaboración de la División de Género y Diversidad del Banco Interamericano. Lo agradecemos mucho. Podría concluir diciendo que la discusión generada ha sido muy enriquecedora y nos ha dejado enseñanzas críticas, lo cual brinda una gama importante de soluciones sobre procedimientos que promuevan una forma de trabajar inclusiva y con pueblos indígenas. Es decir, que los pueblos indígenas y sus estructuras de toma de decisión sean para las decisiones respetando siempre las estructuras de gobernanza indígenas. Termino resaltando que se van a responder todas las preguntas presentadas durante este conversatorio, adicional a las que nuestros colegas que fueron los presentadores no hayan podido responder. Muchísimas gracias por su participación. Gracias a todos los organizadores, gracias a los diferentes departamentos dentro del propio banco, a KIC, a los diferentes organizadores externos también, y en especial Juan, te agradecemos mucho por la gran facilitación. Muchas gracias. Hasta luego.